Welcome to this strategic explainer, put together specifically for you, our local government leaders, mayors, and LGU heads. I'm really glad you're joining us today because we're going to tackle a massive challenge that directly hits the heartbeat of your municipalities, the grassroots health data crisis. Look, we all want better healthcare for our communities, right? But to actually achieve that and to meet national mandates without going broke, we have to solve this huge data bottleneck happening right down at the barangay level. So today, we're diving into a frontline-first digital framework that's built to actually empower your local health workers and secure your LGU's healthcare future. Here is a quick look at what we're covering today. We'll start with the grassroots data problem, then look at what actually causes that bottleneck. From there, we'll introduce the solution, PBB Natalium. We'll also cover how this meets national health mandates, how to mitigate risks to get people to actually adopt the system, and finally, how to ensure long-term sustainability. Okay, let's jump right into part one, the grassroots data problem, and how we are quite literally drowning in paperwork. You know, the national vision for the Philippines is universal healthcare. It sounds great, but honestly, a severe administrative bottleneck at the barangay level is totally threatening to derail it. The health data pipeline is supposed to just flow smoothly from a household all the way up to the Department of Health, but on the ground, it gets completely bogged down at step one. Our volunteer barangay health workers are seriously overburdened. They're forced to manually fill out these massive paper logs and target client lists, stuff like complex child immunization records and incredibly detailed family planning records. This heavy manual workload leads to something called tally fatigue. It causes transcription errors, and it creates massive reporting delays. The grassroots burden is just way too heavy when every single thing is bound to physical paper.
Which brings us to Section 2. What actually causes this bottleneck? Well, it's the digital divide.
Now you might be thinking, well, that's an easy fix. Let's just digitize everything. But it really isn't that simple. Pushing traditional, complex, cloud-based software onto devolved local health systems creates massive structural friction. Take a look at this. According to a recent study on digital readiness in the provinces, only 32.2% of BHWs meet basic computer literacy standards. And if you look at upland or more remote areas, that number drops even lower to just 24.3%. So, when we force complex tech onto primary care frontliners who haven't had technical training, we aren't actually solving the bottleneck. We're just changing its shape. It just leads to severe reporting backlogs because the tools completely mismatch the user's current skills.
And then there's this staggering reality. 74.6%. Nearly three-quarters of rural areas report lacking reliable, active internet connectivity. Think about that for a second. That means any digital health system that requires a constant online connection to work is practically useless in provincial realities. I mean, you just can't run a cloud-based medical record system if the cloud is completely out of reach.
So this leaves every LGU leader facing a highly critical strategic question. How exactly do we digitize our healthcare data without breaking the front line? How do we build something that actually respects the reality of low computer literacy and spotty internet, but still feeds accurate, timely data into the national pipeline? We desperately need a ground-level solution that can survive the harsh, everyday realities of Philippine grassroots healthcare.
And that takes us to Section 3, the solution, PB Natalium, the continuity of care engine.
Now, PBB Natalium is not just another random app. It's a purpose-built, barangay-level continuity of care engine. It's designed specifically to survive and function beautifully in those real-world conditions we just talked about. It organizes primary care and ensures patients are smoothly handed off when they need higher-level care. Under the old way of doing things, tracking was totally fragmented. A pregnant mother was one physical file, and her baby was a completely separate file, which meant continuity of care was constantly getting lost. But the Natalium way introduces a universal patient identity. Basically, a patient is a patient from day one. You build one unified identity in a reusable registry. So when a new health program rolls out, like say, shifting from maternal care over to child nutrition, you don't have to go buy a brand new app or start a new physical folder. You just attach that new health program directly to the existing patient identity. It's highly efficient, and it drastically cuts down on redundant data entry for your staff.
Moving on to Section 4, meeting national health mandates and aligning with the law.
As an LGU leader, your top priority is making sure your municipality is actually compliant with national policies. So any framework you invest in absolutely must align with the law. Well, the really good news here is that PBB Natalium maps directly to these legal mandates.
For instance, the DOH's National Objectives for Health, specifically their 8-point action agenda, demands digital primary care access and integrated services. Natalium delivers exactly that right at the barangay level. On top of that, DOH Department Circular 2026-0047 mandates standardized data encoding and FHSIS-style reporting to take the burden off volunteers. Natalium's automated metrics handle that seamlessly. And finally, the E-Governance Act requires a unified digital framework. Natalium is built from the ground up for structural interoperability, meaning it maps directly to systems like the Global Birth Defects Description and Coding application, which fundamentally protects your LGU from noncompliance.
Let's look at Section 5, Mitigating Risks in Adoption, because a system has to be built for the real world.
Look, even the most legally compliant software in the world is totally useless if no one actually uses it. So how do we get disconnected, overworked rural health workers to actually embrace this system every day? Well, Natalium was engineered specifically for their reality, to mitigate those adoption risks. First up, offline functionality. Because of that 74.6% lack of internet we talked about, Natalium lets data be saved locally right on the device. Then, it automatically syncs to the national repository the second it finds a signal. It's that simple. Second, a simplified user interface. Knowing about those low computer literacy rates, the app prioritizes simple drop-down menus instead of making people type out text manually. This is huge for reducing typing errors and getting rid of that tally fatigue. Third, that reusable registry we mentioned prevents BHWs from having to type the exact same patient details over and over again. And finally, it features secure PBB account integration, which just means a single, super simple sign-on process so users aren't juggling a million different passwords.
Finally, Section 6, Ensuring Long-Term Sustainability Beyond Political Terms. As leaders, you're obviously planning for the long-term future of your municipality. And a major concern with any new health initiative is how it's going to survive financially and operationally once an election cycle ends. If a system requires a massive, independent local budget year after year, it's eventually going to fail. And this is exactly where Natalium truly shines, because sustainability is structurally guaranteed. Instead of your LGU scrambling to fund a standalone registry, Natalium integrates your local intake data directly into massive, fully funded national pipelines. For example, it directly integrates with the National Birth Defects Surveillance, which is tied right into the expanded newborn screening network. And because of this structural integration, the costs are essentially absorbed by national mechanisms like the PhilHealth newborn screening fee. By aligning with standard structures and these massive national funding pipelines, Natalium ensures continuous relevance and financial backing. It literally protects your LGU's budget. So we've seen the painful reality of the paper bottleneck, we've looked at the very real challenge of the digital divide, and we've seen how a purpose-built, offline-capable tool like PB Natalium actually solves these issues while keeping you legally compliant and financially sustainable. So I want to leave you with one final critical thought to consider. Will your LGU take decisive action and lead the digital health transition, or will your health workers remain trapped in the grassroots data bottleneck? The tools for an empowered, sustainable frontline are right here. It is time to build a healthier, connected future for every single constituent. Thank you so much for joining me on this explainer today.